The World Health Organization recently came out with a report saying that dentists should not be practicing unless it's emergency care. But the American Dental Association, also known as the ADA, says they respectfully disagree. They say they've already been closed for months, and closing down again would not be good for them or patients. They're saying they're seeing patients with a lot of now urgent care that would have been minor if they were just open during the whole pandemic, and they don't understand why dentists would not be considered an emergency service when medical is, grocery stores are, but dentistry is not. And I caught up with one local dentist who explains how he feels about the situation.
All our services are actually essential, so especially since there's such a huge connection between the mouth and the rest of your body. I mean, any bacteria, any pathogen which is in your mouth, it flows into the rest of your body. So any patient that had a cavity lingering during that time, which we were advised not to take care of, they essentially had bacteria in their mouth which is flowing throughout their bloodstream. It could lead to plaque in your arteries. It could lead to heart conditions. It can add to other conditions you may have, diabetes, high blood pressure. And actually what has happened is we've had a good number of patients who, prior to us going by that advisory of seeing emergency patients, prior to that, patient might just need like a simple cavity or simple filling. And we hadn't seen them going by the guidelines recommendations, and now we're seeing them. Now it's something a lot more severe because it wasn't treated. Now rather than a cavity, now they need a root canal. And some people maybe needed a root canal, it was starting to bother them. Rather than a root canal, now they need to have the tooth out.
And of course, I'll have more coming up this evening at 5 o'clock, and as always on WPRI.com.